Hi everybody, Dr. Debunk here, and this is part two of the introduction, but we're going to get into the meat of what happened over the last 3 years. So if you haven't seen the first part one, I'm just going to call them part 1 through 8 or so, or probably might even be 12. Make sure you watch them in order because I'm going to go chronologically. So these videos are going to be about the events of the last 3 years and what happened with the Martian invasion. And so you got to see the first video because I'm not going to go back over any of that. So here we are in, say, the summer of 2020. And the Martian has gone all over the world. It's on the news every night. Everyone's like, what's going on? What's happening? You hear about all these deaths. You hear about everything's going on. It was endless. They had the death count ticker, the infection rate ticker. It was just endless, And everybody was trying to figure it out. So let's explain a little bit about viruses. So these type of germs, they're not living entities, but they infect cells and make the cell make more of their offspring. So they just make more germs. And so most of these kind of germs, respiratory wise, like say the flu, the worst thing it can do is give you flu pneumonia. And flu pneumonia is what you'll get when you had a flu for 10 days or 2 weeks, and a couple days in the middle you feel terrible and you're laying in bed. And we had one of these real strong strains back in 2015. It was either 15 or 16, I can't remember now. And that was a bad flu year. I mean, everybody's missing a week or two of work. It ended up killing 70,000 people. But who did it kill? Well, they want you to think that the flu can kill anybody. They actually try to push that stupid agenda, but it's ridiculous. They even try to say you can be an asymptomatic carrier of the flu, that you can get infected with the flu and have no symptoms and infect other people. Debunk. That's the most ridiculous load of crap. But then they push the stupid flu shot for people, which is absurd. Anyway, we'll get to all that later. And so, but upper respiratory viruses until this one, the worst they could do is give you a short little week pneumonia or bronchitis, which you'd get over fine. Healthy people always get over that. But now we have this germ that's putting people in the hospital and killing them dead and killing them fast. And so between April and December, we have a new germ that's doing something we've never seen before. And so everyone had to learn. And doctors did learn, the ICU specialists and the pulmonary specialists, which is usually a combined specialty. Anyway, they're called intensivists. And all the intensivists that treated this had so many deaths. Because normally what happens, if you're going to die of the flu, say, you're typically 75 years old and you have emphysema, you're pushing an oxygen tank, you're half dead, soon to be all dead. That means one big event will push you over the cliff and your heart or lungs will fail. Well, in the case of flu pneumonia, if you or I or anybody at any age that's healthy gets it, even the pneumonia will just make you really sick. It'll say the worst flu you had in 20 or 50 years or whatever, and then you'll be fine. But the emphysema patient or the heart failure patient or other situations, other diseases that are so advanced, the strain of viral pneumonia, which causes more difficulty for the heart to work and fluid in the lungs, that pushes them over the limit. And so every year when they say the flu kills 30,000 people or 20,000 people, that's who it's killing. It's extremely rare for anybody 40 or younger to die of the flu. Does it happen? Yeah. How many people get struck by lightning every year? So are you going to stop going outside when it's thunderstorming because the lightning has it in for you and it's going to strike you in the head? It's absurd. Healthy people don't die from the flu. But now an airborne respiratory virus is killing people, and it killed even younger people. But again, we didn't know at the time, but people that were overweight, people that with diabetes, people with multiple complex medical problems, but then advanced age, over 65, I think that was the official number in the end. They're the ones that were dying, but they weren't dying the way people normally died of the flu. So when you're going to die of the flu, the infection gets greater and greater, and it causes massive inflammation, and that causes fluid. And finally, you're kind of drowning, and you're drowning in a way so that you can't exchange oxygen. So your oxygen deficit keeps growing up, growing bigger and bigger. And you remember on the news, it was over and over again. You got to get your oxygen saturation checked. Get your little finger thing at home. And if you have the Martian, stay at home. We can't do anything. That was a lie. There was a ton that could have been done for people at home. And then if your oxygen saturation gets too low, then go to the ER. And then we admit you, and we started advancing breathing procedures for you, from oxygen in the nose to high flow oxygen to high flow mask, and into something called, like the CPAP machine for people that have obstructive sleep apnea, but it's called BiPAP. And we were desperate to try to keep people at the BiPAP level, because it seemed like every time somebody couldn't finally breathe on BiPAP, you'd go in the ICU on the ventilator and die. And it made no sense, because the ventilator takes it all over, and we can mash air on a ventilator. It's like you putting your mouth on a air blowgun to fill up a tire. But they just died. But after 4 months of this, smart doctors like Corey, and it was worldwide, they figured it out. This is not an oxygen problem. This is a circulation problem. This Martian germ did something we'd never seen before from the airborne respiratory virus. That was, it could cause so much inflammation that it would cause your arteries and veins to clog. And so you were getting pulmonary emboli. You were getting blockages of your circulation. So it wasn't an air problem. It was a no blood flow problem. And then as soon as that happened, it's like, oh, well, we treat pulmonary emboli all the time. I've treated many cases. And I'm just so-called lowly family practitioner. But where I practice, we all had to practice hospital, even ICU, when I came here in 1999. So anyway, so now what's the treatment for that? For clots in the lungs? High-dose steroids and blood thinners. And as soon as you did that, voila, everybody lives. And I had 16 very seriously ill patients, and every one of them walked out of the hospital, because these guys, like Corey and the other ones, started putting the information out there for primary care. And so the whole thing should have stopped very quickly, but it didn't, because the government and the big universities weren't promoting this treatment yet. They ostracized people like Corey. They went nuts over doctors who were saying this. And for, I don't know how long, 6 months or longer after that, even into 21, these stupid protocols were being pushed. And that evil drug remdesivir, which killed so many people, kept being pushed. And that's what I'll end it with. That drug has no science to support its use. The 2 review studies I found about by 2022 or so, a little more, had showed that there was no benefit. Whether you got remdesivir or not in the hospital, you had the same chance of walking out alive. But it's a seriously toxic drug to your liver and kidneys, even heart. It was a failed Ebola drug. They took it off the market, and magically, it became the go-to pushing drug everywhere in the country, from the universities to the government to the CDC to Gauci. Everybody was saying, it's magical, give it and they'll live. And it didn't do anything except kill people. And who knows how many dialysis patients we're going to have because of that drug. And of course, the mainstream doctors will say I'm crazy, but the data supports everything I just said. But you have to look at the data. If you get your data from CNN, well then. So that's what happened the first year with the serious variant. It was real. It was no joke. We're never going to know how many it really did kill. But finally, by I think the end of 21, everybody was doing the protocols that had come out a year earlier but weren't being used. And so that's kind of where we got to. And then in the late summer of 21, I think, the new variation came out. And that's what we're going to pick up next time. I'm Dr. Debunk.